Okay, this is Brian Edwards. Brian is the principal consultant in pharmacovigilance and drug safety with NDA Regulatory Science, but that's not the fun part. The fun part is he's a very brave man. He's a very brave man because he's the father of 5. He bicycles to work. He's passionate about craft beer, rock music, and medical product safety. So thank you, Brian.
Thank you, and thank you to the... I haven't finished my talk yet. Thank you for the organisers for inviting me to talk about what makes me passionate, and that is putting medicines into people and seeing what happens. However, once upon a time, there was an emperor called clinical research, and he thought he had a system. And there I was, jumping up and down, saying, wait a minute, this isn't working very well. So what did I do? I've written a series of papers describing how the system could be different. But of course, mistrust was high and denial of the problem is rife. And everyone keeps pretending that there is a system. And the need for radical reform was great. But what could I, as an individual, do? Because the system had become Orwellian and Kafkaesque. Words become meaningless, engaging, openness, clarity. There was a terror of deviation, a witch hunt for conflict of interest. I mean, to put it simply, the system, okay, it produced medicines at the end of the day, but it was like a dog's dinner. It was edible, but would you want to eat it? I mean, the reason why we have failed, and I note you use this fantastic quote, is because we were not complying with Einstein's advice. Insanity, doing the same thing over and over again, expecting different results. This is what we do. We can't solve problems by using the same kind of thinking. So we've got to do things differently. We've got great science, great people, great products, but a lousy system. So I fully understand we mustn't throw the baby out with the bathwater. And I know I hear you say, or hear you think, it's all too complicated. What could we do? We only have to think about all these silos, all these conflicting priorities. But this is where a.k.a. comes in. The Alliance for Clinical Research Excellence and Safety, a not-for-profit organisation, has been set up in the US with the aim of driving the creation of a global system by identifying what the challenges are, planning some solutions, and then getting on with it by working with allies and stakeholders. Identifying the relevant people, the competencies, what processes, what technology, coming up with site certification, accreditation, looking at quality management, thinking new ways, new solutions for risk and safety. So this is a.k.a., this is our website. It's a multi-sector alliance of like-minded people and organizations working collaboratively to build a shared global system for clinical research, an integrative system, an incubator for new ideas. We have these initiatives around site development, operation support, information system management, and quality management. And here I am, I'm in the safety one. And it's absolutely fantastic to work, all of us, on completely new ideas. We're working on projects that no one else is. So please, look at our website, come and join us. Let's get this party started. Because the truth is out there. We can't carry on going on like this, because the reality simply will not go away. We have to work together to create a global system. Because remember, you can accomplish anything in life, provided that you do not mind who gets the credit. Thank you very much.